Today we're talking about what you need to do to prepare for surgery. I'm a physical therapist and Pilates teacher with over 20 years of experience. I also have had 4 major surgeries myself and am preparing for my 5th major surgery in just a few days. I have quite a few tips I want to share with you if you ever have to prepare for a major surgery. This is going to help you feel like you can recover quicker, you'll have better outcomes, and you'll feel like you're in a little bit of control over what is happening. So I'm going to share with you my top 5 tips today, and keep in mind I actually have 9 tips and I cover all of those in my podcast episode, which is a sister episode to this. So in my podcast, Meet Your Body, I will have that link to my podcast episode about prepping for surgery below. So there are actually quite a few things that you can and should do as you prepare for any major surgery. And the first one is to find out exactly what you're having done. And I know that might sound a little silly, but it's true. I have worked with so many clients who have surgeries coming up and they aren't sure exactly what they're having done. They might know that it's a knee surgery, but they don't know what procedure they're having done. They might know that it's a shoulder surgery, but they don't know exactly what's happening. Are you gonna have screws or not? Is it an open incision or not? What exactly is happening? And it is vital that you know what kind of surgery you're having and what is being done and why. I think it's really helpful to actually know why you're having that surgery. So again, on paper, it might seem like you can say, yeah, I know I'm having this abdominal surgery, but ask the questions. Ask your surgeon what exactly is being done, what procedure they might be using, and why. Why is that the best choice for you at that time? Having that information is going to be so important going forward. So the number 1 tip is to find out exactly what type of surgery you're having done. My second tip follows that a little bit in that it requires you to ask questions. So my second tip is to ask your surgeon and the nurses and assistants all the questions. There are so many things to know as you prepare for surgery. And to be honest, they're not usually volunteering that information. So many things that I have found the most helpful for surgeries, I have found out from friends and colleagues who have had that same surgery. Many of you who follow me know that next week I am having a double mastectomy and reconstruction because I was recently diagnosed with breast cancer. It's a really scary time full of a lot of unknowns, and I am so grateful for my friends and colleagues who've reached out and shared their experiences with me, because there are so many things that I didn't know that I'm gonna need afterwards, and because they've told me, I can now take those questions to the doctor. So you are gonna wanna ask everything you can think of, which is gonna include, what do I need at home afterwards? Okay, you might need a range of motion machine. You might need certain garments to wear. You might need things that are gonna help you shower. You might need a chair in the shower. There are so many things that you could need. Ask beforehand, because you're not gonna have time afterwards to take care of these things. You're gonna come home in a fog, in pain sometimes, and you're not going to be able to take care of them then. So ask the questions ahead of time so you can be prepared. Find out, like I said, what you're going to need at home. Find out what your restrictions are. When can you drive again? When can you lift again? When can you walk again? When are you weight bearing again? Can you do stairs? Can you sleep laying down? Or are you going to need a recliner to sleep in? There are so many things that you can ask and find out. So ask all those things ahead of time. Do not be afraid to be the squeaky wheel. I just had my last pre-op appointment yesterday and I had so many questions, and I think that sweet assistant wanted to get up and leave the room each time because she thought we were done. And I said, oh no, sorry, I have another question. Ask them all ahead of time. You also want to know things like, when do you need to stop eating and drinking before surgery? Does someone need to drive you? Is there free parking? What do you need to wear to surgery? Ask all of those questions ahead of time so you're as prepared as you can be. My third tip as you prepare for surgery is to keep moving. Keep moving your body. Now, All surgeries are different, and I know if you've had a major orthopedic issue, such as you need a total knee replacement or you've had an ACL tear, your movement is going to look a little bit different. But we know from science, we know from research without a shadow of a doubt that keeping strong and keeping moving prior to surgery will help your outcomes. That is simply the truth. So that might look like continuing your normal workouts. For me, I'm not limited right now. I am just continuing my normal workouts leading up to surgery. Now, in the week before surgery, I'm not trying anything new. I'm not going crazy. I don't want my body to be sore because I need my reserves for healing. But you better believe I'm going to be stretching and be on a long walk the day before surgery. And I will be walking the day after surgery because it's recommended by my doctor for healing. So find out what your restrictions are both before surgery, if you have any, and after. But remember, you want to keep moving your body before surgery. I also recommend, again, depending on what you have going on, that you have physical therapy beforehand. And that, again, goes for things such as pelvic floor issues, knee, ankle, shoulder, every orthopedic issue you can think of. We have better outcomes when we do physical therapy beforehand and when we strengthen beforehand. So talk to your surgeon and your doctor as needed, but remember, it is very helpful to continue moving prior to surgery. My fourth tip is to schedule any appointments that you need after surgery beforehand. Again, if you've never had surgery before, you might not understand that you go home in a fog. Even if it seems like kind of a simple outpatient surgery, you have been under general anesthesia. It's a major trauma to your body. You'll feel foggy. You will be very tired. You might be on pain medication. And so you don't want to be looking for phone numbers and calling and trying to get squeezed into the doctor for appointments that you need, especially if it's something like physical therapy afterwards. They can really book out for a few months. So anything that you need, it could be a post-op appointment with the surgeon, it could be physical therapy, anything like that, schedule it beforehand. Get it done so it's on the books and you're ready to go. And then my final piece of advice for today in this episode, as we talk about how to prepare for surgery, is possibly the most important one. And it is doing whatever kind of prep that you need for yourself ahead of time so that you are ready in a good mental space. What I mean by that is if you need to grieve, if you need to mourn, if you need to rage and cry, if you need to do that, do it and do it ahead of time. I remember when I had my hysterectomy and prolapse repair 4 years ago, I needed to have it done. We couldn't have kids anymore. I wanted more kids. It was a hard time knowing that that was going to end that part of my journey, and I had to do some mourning around that. That is the time that really kind of solidified for me the importance of going through that, because I wanted to be able to wake up from surgery and focus on my healing. Your job when you wake up from surgery is to heal. That's it. That is your job, is to focus on your own healing. And sometimes being able to have a little bit of closure around those emotions before you go into surgery can really, really help. This is an interesting, different situation for me. Being diagnosed with cancer was quite the surprise. I have a lot of emotions as I go into this, and it's been a whirlwind and a very quick turnaround because of the specific diagnosis. I haven't had a lot of time to process the emotions, and I know realistically I won't have time to process all of them. I know this is going to be an ongoing thing as I find out more information and as I go through with treatment and rehabilitation. I also know that I need to cry and do all the things that I need to right now so that when I wake up, I can focus on moving forward with positivity, moving forward on my own healing. So if you are at a place when you're feeling a little bit out of control, when you have some resentment or some sadness around the surgery that you have to have, take a moment, take a few hours, take a day, take whatever time you need to journal or go on a long walk or talk to a friend or sit in silence or just let the tears come. Whatever you need to do, do it now. Honor that part of yourself so that you can move on for your own healing. I hope that those 5 tips helped in whatever space and journey you're on with your own surgery and your own healing. I know it can be a lot. So take it one day at a time, take it one moment at a time. And again, feel free to check out my podcast where I'll have even more information around this subject specifically. The link is below. And thank you as always for being here. And I'll talk to you soon.